Hello, welcome back to Learn Anatomy with Dr. Vessel. We want to answer some multiple choice questions to help us understand what we've been discussing on ossification of upper limb bones. Now, my first question is, which of the upper limb bone primarily ossified by intramembranous ossification? A. Humerus. B. Radius. C. Ulna. D. Clavicle. Now you know that the answer to this question is clavicle. And if you can remember the mnemonic I gave, I said clavicle is not clever. And the clever here helps us remember that the clavicle does not ossify through cartilaginous, but it ossifies through membranous. Another mnemonic you can remember is the most mnemonic, where we say that MO represents membranous ossification that is seen in clavicle, except the medial end of the clavicle that ossifies through cartilaginous. But clavicle is not clever can help you remember that the clavicle does not undergo intracartilaginous ossification, but it undergoes intramembranous ossification. The next question. The clavicle begin ossification at approximately A. 4th week interuterine, B. 5th week interuterine life, C. 7th week interuterine life, D. 8th week interuterine life. The answer to this question is 5th week interuterine. Remember, we say the clavicle is very special. It is the first bone to start ossifying. It has two primary centers and one secondary center. And you should take note that the clavicle ossify by 5th to 6th week intrauterine life. The next question is, the secondary ossification center of the clavicle appear at the A. Lateral end, B. Medial end, C. Acromial end, D. Chaff. Now, this mnemonic I say there, most, remember I told you that this most help us remember that the clavicle ossify through membranous ossification except the medial end, and is that medial end is where the secondary ossification is located. Now the medial end is where the secondary ossification is located because it undergoes intracartilaginous ossification there, while other part of the clavicle undergoes intramembranous ossification. You must take note of this. The next question says, which of the following bones has only one epiphysis? Which of the following bone has only one epiphysis? A. Humerus, B. Radius, C. Clavicle, D. Ulna. In one of the videos we made, I gave you a mnemonic that the two first letter of secondary center can help you remember that the secondary ossification center form the epiphysis. And as we said before, we said the clavicle is a special bone because it have two primary ossification center and one secondary ossification center. And the clavicle is the only bone that have one epiphysis because it has only one secondary ossification center that will eventually form the epiphysis. The next question says, the head of the humerus ossify from A. One center, B. Two centers, C. Three centers, D. Four centers. Now, we say the head of the humerus and the lower end of the humerus forms the secondary ossification center. Now, the head of the humerus has what? Three centers, which we use this mnemonic greater and lesser head. Where we say that the ossification center is located at the greater tubercle, lesser tubercle, and the head of the humerus. It has three ossification centers, while the lower end has four ossification centers, where we use the mnemonic clever men teaches clever men teach leaders. The mnemonic we use to remember the ossification center at the lower end of the humerus. Now the next question is, the growing end of the humerus is located at the A. Proximal end, B. Distal end, C. Both end equally, D. Chaff. Now I told you that the growing end of the upper limb is away from the elbow joint. If this is the elbow joint, if this is the humerus, this is the elbow joint, this is the ulna and the radius, the growing end is away. So the growing end of the humerus is at the proximal end, while the growing end of the ulna and radius is at the distal end. So the answer to the question is at the proximal end, because the growing end of the upper limb runs away from the elbow joint. Now the next question is, the growing end of the radius is A, proximal end, B, distal end, C, mid shaft, D, neck. From our explanation, the answer is distal end. Now the next question is, all carpal bone ossify after birth except A, capitate, B, humerus, C, scaphoid, D, all ossify after birth. Now the answer to this question is that all carpal bone ossify as after birth, because there's no specification that occurs before birth for carpal bone. They are all cartilaginous at birth and they ossify after birth. The next question is, which of the following epiphyses appear first in the ribs? We're talking about the carpal bone. Which of the following epiphyses appear first in the ribs? A, scaphoid, B, lunate, C, capitate, and D, triquetrum. Now, there's a mnemonic I gave in the last video of ossification of carpal bone. We said crazy tiger, crazy hungry tiger love to steal tasty pizza. Now, crazy hungry tiger love to steal tasty pizza can help us remember that crazy help us remember that the carpate is the first bone that ossify in the ribs, and the carpet ossify around the third month, while the humerus ossify the second bone. The third is triquetrum. So the answer to the question is the carpet. I've come to this multiple choice section. Thank you for watching.